Welcome to the Birth Abroad podcast. My name is Megan Jennings, and I'm honored to host mothers who have come here to share their overseas childbirth stories. From fertility journeys to postpartum and beyond, this podcast is meant to hold space for women all over the world to share their unique experiences with the challenge of becoming a mother away from one's home country. Let's get in today's episode. Hey friends, and welcome back to the show. Just as a reminder, this will be part 2 of a 2-part story told by my guest Jovie Paredes. I would suggest that you go back and listen to part 1 if you haven't done so already. But assuming you have, this is the conclusion to her story, and I hope you enjoy it. So what is postpartum like out there? I had heard actually on one of your YouTube videos about how you guys have the nurses or the doctors that come and visit you. Do they do that postpartum? How are those first pediatric appointments?
Yeah, so in the Netherlands, we have something that no other country has in the whole world, and that is called a kraamzorg. And basically what happens is after you give birth, if you have a regular vaginal delivery, usually you'll get sent home within 4 to 6 hours after giving birth. And you're probably thinking, excuse me, what? But that's because every woman here has this kraamzorg. And a kraamzorg, she is like a postpartum nurse or postpartum doula, something like that, like a mix between. She is specialized in postpartum. And they come to your house and they spend 8 hours a day with you for the first 8 days they're in your house. So they check you, they check the baby, they weigh the baby every day, they assist with breastfeeding, they cook for you, they clean your toilet every day, they sterilize your toilet, they sterilize your shower, they fold your laundry, they greet your guests, they cook coffee for your guests, they serve whatever desserts or sweets or whatever you want to give to your guests. They are there to support you 100%. Any question that you might have, they teach you how to give a baby a bath. They teach you how to change a diaper if you've never done that before. They, anything that you need to do, they help you with it. They help you through it. It's unbelievable.
I picked the wrong country to have a baby.
No, but isn't that not incredible to have that at your house? And that's why you don't need to stay longer at the hospital, because whatever, like, if you give birth in the middle of the night, they will let you stay until morning. But if you give birth in the morning, they do send you home. And no matter what time it is in the late afternoon or evening, the kraamzorg, she will meet you at your house on that first day, no matter what time it is, and make sure that you're set up for the first night. If you have any questions, if you have anything, she gives you her phone number. You know, it's like really just like making sure that you're okay for that first night, and then they're back the next morning.
Is this something that's covered by social insurance?
Yes. Mm-hmm.
Oh my gosh, I'm so jealous.
Yeah, it's incredible. It is, every woman deserves this, right? Like it is, and parents don't, like my mom could have come, right? But it doesn't compare, because your mom, she wants to spend time with the baby and she's not like an expert in, oh, this poop looks maybe a little bit off color, maybe we should check with the doctor, or you know, like these people are like really specialized. And I remember the first day that we were home, and I just remember being so tired because that first night was really difficult with our son, and neither my husband nor I slept, and it was just very challenging. And, you know, we fed the baby, and then she looked at us and she goes, you need to feed the baby again in 3 hours. So for the next 3 hours, I will watch your child, and you and your husband go upstairs and go to sleep.
Oh
and we were like,
gosh.
What? Really? She's like, yeah, go sleep. So she kind of forced us to go and rest, which is also so important. When we woke up, we went downstairs and she had not only done all the laundry and folded the clothes and everything, but she had prepared 2 little bowls of fresh fruit for us and like a snack. And I looked at that and I just started crying because nobody had ever done anything that nice for me in my whole life. It was like those little details that are just amazing. And they do that.
You know, I wonder actually how, I wonder what the postpartum depression incidence rate is in the Netherlands compared to countries that don't have an individual like this. Like, just having someone to help you and reassure you in that first week and allow you to recover physically and sleep,
Yeah,
that's got to affect your mental state so much.
of course. Yeah, I that's actually a really interesting question that you bring up. Maybe something to look at if there's research done on that. But yeah, it's an amazing thing to have that support here. And then also they work in tandem with the midwives who will also visit you at home in the days following the birth. So the Kramzorg, she is there like monitoring the baby every day, like with the weight, the how many dirty diapers they had, how many wet diapers, all of these things they're checking. And then if they suspect anything, then they can tell the midwife. Both the Kramzorg and the midwife will check your stitches, they'll check the baby, they check the umbilical cord, like all of that stuff is done in your house. You don't need to leave. You literally don't need to leave for 10 days if you don't want to, or 20 days. Like you don't need to leave your house at all. Everything is done in your home. I mean, of course, if there's an emergency, you would leave, but if
Right.
everything's normal, you don't need to leave your house. And that's also so comfortable, right?
Yeah.
Because the last thing you want to do is leave, like try to like now after you've had a surgery or even not, I mean, like having the tears that you spoke about, like
Yeah.
I can imagine walking was not your favorite thing to do.
I
So
was
like,
waddling for weeks.
yeah, it's horrible. No, it's horrible. So the fact that you can find a comfortable position on your sofa and not leave is like really great.
Yeah.
So
Yeah, I can imagine.
and then also they track this progress like every Kramzorg has a little book that they give you where later on you can look back at it, and they ask you like how's the mom feeling? How's the baby doing? And they track everything and they have all these notes that they take during your postpartum period, like about you, about the baby. I remember the one in one for my son, she wrote, Mom wanted to go outside today, so she took the dog for a 5-minute walk, and she came back after having some fresh air and said that she felt really revived. Like that is such a silly small thing that I would not have remembered had I not had this like book from the Kramzorg. I don't know.
That's so sentimental. That's
Yeah.
beautiful. It's like a time capsule almost
It
of a
is.
period of time that's already so crazy in your head with the sleep
Yeah.
deprivation and the baby and the breastfeeding
Yeah.
and the this and the that. How nice to have.
Yeah. Yeah. So
Oh,
it was great, and that was kind of the end of that. After 6 weeks, I did have to go back to the gynecologist to just get a check, but I was healing. I was healing okay. That was my issues came a little bit later when one of my hips was like not properly, like as a result of the contractions and the labor, my hip was displaced or something happened with it, and then it was very painful to walk, but that was only like a couple months after the birth. But if you remember, I mentioned to you that I had gained 25 kilos in my
yes.
pregnancy 3 days after giving birth. So, in the days after giving birth, I had also mentioned that every contraction would like gush fluid.
Mm-hmm.
Within 3 days, I lost 23 out of the 25 kilos. It was all water. For whatever reason, my body just held on to every milliliter of water that I had drank
No
in the
kidding.
entire pregnancy. So every contraction was just water just coming out of me. 23 kilos in 3 days. Like it was just crazy. Um,
You must have felt like you were walking on clouds after that.
yeah, yeah. And it wasn't until my son was actually born that I realized that the entire time that I was pregnant, I had, I think you call it antenatal. So during the pregnancy,
Yes.
extreme depression and anxiety. That was something that I didn't realize until after he was born and I felt like myself again. It was really interesting because I just thought, oh, I'm having all these like thoughts and all of these feelings because I'm going to be a new mom, a first time mom. I don't know what to expect. So, of course, it's normal that I'm this scared. It's, of course, normal that I'm this anxious when ultimately it was not normal what I was going through. And because the gynecologists, they never actually asked like about my mental state, or they never asked like, they were really focused on the baby, is the pregnancy fine, but not, they don't care about your overall well-being. Nobody ever thought to ask about how I'm doing. that it was never diagnosed in that first pregnancy. So I learned only after I had him. I felt like I just woke up from a 9-month sleep. Like I looked at my husband. I was like, I'm back, and he was like, there she is. He didn't know what had been going on, but because it was our first baby, we didn't know what to look for or what any warning signs were. So yeah, so I was feeling I was feeling great. I lost all the water, and I lost, not about like losing weight. It's not about losing weight, right? Because I was really proud that my body was growing this baby. And even if I gained 25 kilos, I gained 25 kilos, but it was just confusing because I didn't understand why it was happening. And
Exactly.
then
At least
later
it's
on,
an explanation for what was
yeah,
going on. Mm.
yeah. So I don't ever, if anybody is listening, I'm not shaming anybody for gaining weight during their pregnancy. That's not the case. It was just like, where was it coming from? What was causing this gain? And it was just that my body was just holding on to all the water that I was putting into it. Because that was my only pregnancy craving too, was water. I was drinking tons of water. I couldn't get enough.
Did they ever mention anything on ultrasounds that maybe you had more fluid than, like the average pregnancy?
No, because the fluid was not just for him. It was in my pinky toes. It was in my
Right.
fingers. I don't know, my hair was maybe even fluffier and more full of water. But if there was a part of my body that could hold on to water, it was. So I was just everywhere. I was like a little water balloon.
You were a human cactus.
Yeah, exactly. So it was crazy. But yeah. Yeah, it was great. We had this like lovely time with our son, and when he was about 2, we decided, oh, let's start trying for another one, because we knew we wanted to have 2 children. And yeah, we started trying, and again, it took months and months and months for us to get pregnant. I don't know why that was or what was going on, but finally we did. We got pregnant again, and it was very exciting. But very shortly after I got pregnant, the anxiety and depression came back. And it came back and hit me in a way that I cannot describe. It was a million times worse than it was when I was pregnant with my son. I was literally not able to leave my sofa without this crippling fear that I was going to fall, and I was going to fall on my stomach, and I was going to kill my baby. That was the only thought that dominated my mind for months. And I ended up going on a 3-month medical leave from my job because I was not able to go to work. I wasn't able to take my dog out. I wasn't able to do anything. I couldn't take a shower. I couldn't leave the sofa. My son would say, "Mommy, let's play together." And I was like, I can't get up. I can't leave the sofa. So for the first, let's say, 5 or 6 months, I had this awful, debilitating depression and anxiety about the baby. And I was just completely handicapped. I couldn't do anything. I was under the care of a midwife at that point, thank goodness, because once we got pregnant the second time, there was no doubt in our minds what we were going to do. So we went to a midwife, and the midwives arranged for me to see a psychiatrist that is specialized with pregnant women. So I was also under the care of a psychiatrist, and there was a lot of worry about what's happening with me, but because I had had it with my first son, I was able to recognize that I was having these same feelings, only magnified so much more with the second pregnancy. Luckily, somewhere around the sixth month of my pregnancy, those feelings lifted, and they got to the point where I was not that afraid to leave my house. I could walk my dog. I even started going back to work for like a few hours a day. So it got better. It didn't completely go away, but it did get better. Also, with my daughter, I was thinking, well, I had diabetes with the first one. Maybe I will have it also with her. So from the moment that I found out that we were pregnant, I immediately went back on my 6 meals a day kind of diet plan that I had when I was pregnant with our son. Because I kept an online journal, it was really easy. I just went back to that, and I was just following the exact same plan. And I was like, I'm not going to get it this time because I'm going to be smarter, and I'm going to like already approach it like this from the beginning. That didn't work. I also it, it it didn't work. So when I went and I had the glucose testing done, it was again, yes, it was positive for diabetes. But that test kind of sucks, right? Because that test, you go in, they draw your blood, and then you drink this like sugar bomb. And then they told me that I had to sit in a chair. I wasn't allowed to leave. I wasn't allowed to walk around the hospital. I couldn't do anything. I had to stay completely still for 2 hours. And then they
Yeah,
checked my blood again.
I don't know why they do that. In Sweden, we don't take the drink unless, I guess, like blood pricks suggest that you need it. But I
Yeah.
hear stories a lot from women in the US, and it's like they keep the women, locked in a room on quarantine for some reason. I don't know why it's like that.
Yeah, because as soon as you start moving, then your body is starting to process that sugar, right? So,
Okay.
but I mean, like in my pregnancy, like I knew I would eat something and then I would go for a little walk. Like I would never just eat and then not move, right? So I was getting really frustrated at that test because it was testing for like a condition that like wasn't happening. You know what I mean?
Right.
Like it
Yeah,
wasn't
yeah,
like a
yeah.
real.
Yep.
So I was very frustrated with that test. But anyway, it was it's true. For my second pregnancy, I didn't move from the sofa. So I would eat and then not move and then but I was eating in a different way. Again, I wasn't eating that sugar bomb, but fine. I had it. It was diagnosed. I was like, okay, I accept that I have diabetes again, and I'm just going to be really, really careful. Um, but with my daughter, I only gained 10 kilos with her, so I didn't have the same issue with the water. I didn't like. I really just I was like one of those women, you see them and just the bump. Like everything else didn't look pregnant. Whereas with my son, it was everything was pregnant. But yeah, so with her, it didn't happen like that, but I did have the diabetes. So again, I had to go under the care of the gynecologist, and the midwife was like, I know you want to be with me, but you've made it clear that you're going to go for a planned C-section this time. I cannot help you with that. So at about 20 weeks of pregnancy, I had to go to the care of the gynecologists. Now, my husband and I, we decided for a planned C-section only because, again, going back to how alone we are in this country, we just didn't feel like we had enough support that if I went into spontaneous labor in the middle of the night, what were we going to do with our son? What were we going to do if I ended up having a C-section and then now I have to be in the hospital again for 3 days? We had no backup plan on who would be able to take care of our child. So we felt like, okay, if we do a planned C-section, then we know the date the baby will be born. We can definitely get his mom or my mom, or it ended up being my aunt who came to stay with us and she took care of our son. Like we just felt like we had more control over the situation of our son
Yeah.
by doing a planned C-section. So once we decided for that and made it clear, then then they said, okay, no problem, you can opt for that. I didn't mention in the Netherlands, now I'm curious how it is in Sweden. You are not allowed to have an elective C-section for your first child.
I don't know if that's the case here, but it sounds like it probably would be. I know it's really difficult to advocate for an elective if there isn't like a serious medical reason for it. But is it the same in the Netherlands? You're not allowed to do that?
You cannot. So you cannot say, "Oh, it's my first baby. I want to have a C-section." I think in the United States you can, and in lots of other countries you can choose for a C-section. In the Netherlands you cannot. For the first one, no way. It's only vaginal or emergency C-section. Those are your choices.
I honestly wonder if it has to do with finances, since
Probably.
it's a C-section is so much more expensive.
Yeah.
Um,
But also they have this whole approach to birth is natural. Birth is not a
yeah.
medical condition. That it's a very empowering it's an empowering way to look at it. But if you're not from the system, if you didn't grow up in the Netherlands, if it's not the way that you look at birth, it can be a little bit like, well, wait, this is not how I think of it, It didn't
Right.
line up with my thoughts. But for the second one, it did. I mean, I understood, and I would have chosen to have like a natural birth or like to try for a VBAC. But because we just didn't have the support for our son here, we just thought it's just easier to do an elective C-section at this point.
Right.
Once you have had a C-section, then you are automatically considered like an at-risk. So you are allowed to choose for your second child to be born via C-section. That's allowed, but for the first child, no. So, sorry, that's a lot.
Yeah, no, that's okay. Let me interrupt real quick. Because you guys were in a unique situation where neither of you were Dutch and neither of you had like immediate family members in that country, before you had your second, had you ever talked about the possibility of maybe switching jobs, going back to either your husband's country or the US or what have you so that you could be closer to home?
No. I mean, yes and no, but the truth is that The Hague, which is where we live, it's called the International Capital of Peace and Justice. And that's because all of the permanent courts for not international law, but like for the Permanent Court of Justice, which is if two countries have a dispute with each other, that case would be tried here in The Hague. Similarly, any people accused of war crimes or crimes against humanity, any of those cases, they would be tried here in the Netherlands. And that is my husband's ultimate passion for his career.
Yep. Okay.
And the only place that we could practice that and have some kind of like normality or normalcy in our life is here in the Netherlands. Yep. There have been other ad hoc courts set up in other parts of the world, like Sierra Leone, Cambodia, Kosovo. There are other places that you can do some of this stuff, but those courts are not permanent. And so you go there for a few years, and then those tribunals end up winding down and closing down, and then you move somewhere else.
And you have to uproot again. Yep.
Yeah. So we know that the Netherlands is for us. We're staying here, and that's it. Moving away would be giving up his career, and that's right. That's a lot to give up when you've worked for it your whole life. So so no, we just knew we need to figure out some other, something else, and in the end I gave up my career so that I could take care of our kids, and that's been the best decision I've ever made. I don't regret that for a second, but it was as a result of not maybe having my mom around who could babysit a couple days a week or something. It was it's different. So
your aunt was able to come then and be with your son.
Yes, she ended up coming, and our daughter was born. Well, here's an interesting thing is that the doctor that was on call for my emergency C-section with my son, he was an artist, honestly. Like, you could barely see the scar afterwards. Like, he had done such a good job with the surgery that when we decided to go for a second C-section, we knew that we wanted him to be our doctor again. So when we went to the hospital, we were asking to see him, and they were a little bit hesitant to let us see him, and I didn't understand why that was. It was only in our first meeting with him, like, not in an emergency setting, that we understood why, and that's because his specialty is gynecological oncology. So the fact that he is such a masterful surgeon during my C-section is because he is doing oncological surgeries on women all the time. So he is just very skilled at that and really, really does something special. But we were saying, Dr. Pelican, that's his name, which is a funny name, but Dr. Pelican, you were there when our son was born. You agreed with me to have a complete anesthesia. You supported me there, even though the anesthesiologist was not, in agreement. We just have a lot of faith in you, and we have a lot of trust in you. And we would love that our daughter is born with you too. And he was like, I'm really flattered. I appreciate it, and I agree to be your surgeon, but I don't agree to be your oncologist. No, oncologist. You are, oh my gosh, you're OBGYN. I don't agree to be your OBGYN. So please meet with my colleagues for the remaining pregnancy. Like, they will follow you and do all the checks and all that stuff. And then when it comes time to actually book your surgery, you can request me, and I agree to do it. So that was our agreement. We agreed. We were like, fine. So other doctors monitored my pregnancy, and everything was going okay, and it was fine until the 30-week scan for my daughter. And at the 30-week scan, the lab tech or the ultrasound tech was like, I think I see something, but I'm not sure. And you know how they are like a little bit
Yeah.
vague. And then that sets you into a panic. And like, what do you see? And what they saw was that there was like something with her kidney. They couldn't explain what it was. There was something with her kidney. They just weren't sure. One was bigger than the other, and they weren't sure. So then this set off like a whole bunch of testing. And even again, I had to switch hospitals, and our hospital sent us to Leiden Medical Center, which is like the leading hospital for pregnancies and things in the Netherlands. It's one of the best hospitals in the country. And yeah, the doctors were saying that there was something with her kidney, and they weren't sure what it was or why it was there. But yeah, so that they wanted to just monitor it while I was pregnant. They were like, try not to worry. And I'm like, I have 10 weeks of pregnancy left. What do you mean, don't worry? You know what I mean? Like,
Right.
how can you say that? Don't worry. Like, but they were saying, we don't know if it's going to require surgery the moment that she's born or if she's going to be fine. Like, we don't know. And we won't know until she's born. And I'm like, great. So we ended up going for all of this testing. And what the doctors told us is that most likely she would not need a surgery right away, but that they would put her on antibiotics from the moment that she's born, and she would just be on them for a very long time to prevent any bladder infections and UTIs, because they could see that there was an issue with her kidney and her urethra or ureter seal is how they called it.
Okay.
So we were like, okay, fine, we know this is happening and it's okay. So I tried not to stress, we tried not to think about it, and we just tried to get through the rest of the pregnancy, and of course we did. On the day before the scheduled C-section, we were supposed to go to the hospital. We showed up there, and they showed us to our room. It was already there. It was like a hotel room. It was very like nicely done, She's like, you're gonna come here, this is your bed, this is your room, and you're gonna come here, and tomorrow morning just make sure you don't eat anything in the morning, and you're gonna come and this is where you'll stay, and then we'll come and get you. And like, she just explained everything. They were so nice. It was such a different vibe to this. Also because that surgeon that I mentioned, Dr. Pelican, I said to him, Dr. Pelican, we're going to need to do the C-section under total anesthesia again. And he was like, yeah, I find that very interesting. Can you explain to me what happened? Why? Like, it was the first time he was getting to hear the story, which was, 3 years later. And when I told him about the phobia, he was like, yeah, okay. He was like, I will support you in this again, but I do want you to have your phobia officially diagnosed by a psychiatrist. And I'm like, no problem, because I'm already under the care of a psychiatrist,
Right.
So the psychiatrist definitely did, and it's real, and it's not a joke, and it was like a big thing. So as a result, then we had meetings also with the anesthesiologists beforehand. We had all the meetings with the whole team, with everybody, and everybody was on board and much more supportive than in that emergency setting. And I understand why, like, I can see why that would be more supportive, but yeah, it was better.
But it's like you said, it sounds like they really supported you in this though, and didn't, try to override your feelings and thoughts and everything like that. So that's really nice to hear.
Definitely. The second time, definitely. But I also think the fact that my husband, lodged a formal complaint against that previous anesthesiologist with the hospital for the way that he behaved, maybe that taught, maybe they had a learning experience out of that too. But in the end, it was okay. And one other thing I think that's relevant here to mention is that because my second pregnancy was so rough for me, and with that whole depression and anxiety and everything, I was basically an absent mom to our son the whole time that I was pregnant, almost the whole time. He would ask me to do things and I couldn't, and it was terrible. And I knew that I never wanted to put him in that situation ever again. So I knew that my second baby was going to be my last baby, that I would not be having, well, not necessarily, I'm open to adoption or having somebody else carry a child for us, but I will not have another pregnancy myself in my body, because of the way that my body reacts to it. And so we talked to the doctor and asked him if he would perform a tubal ligation, if he would remove my little tubes so that I could not get pregnant again, as a part of the C-section. So I'm already having the C-section, and can I also have a tubal ligation at the same time? So that's also not that common here in the Netherlands, because they don't really want you to make that kind of decision when you're pregnant, when your hormones are wacky anyway. But I was sure, and my husband too, and with the help of our psychiatrist and psychologist and all the team, there was like a whole team involved, because of, I was sure that I did not want to put my son through that again, of like another pregnancy where I'm an absent mom and now there's 2 kids, like that was just not in the cards for us. So that was also part of the planned C-section, was my tubal ligation.
And they were okay, and they were happy to help you with that, yeah.
Yeah, even though they were saying, this is not very common in the Netherlands. Like, they were kind of making a thing about it, but they were like, but we understand that you are pretty clear on what you want, and you seem like you're not going to change your mind. And I was like, no, this is it. So then they were supportive. It was they were gently trying to just make sure that it wasn't a rash decision.
Right.
So all that happened in my second pregnancy.
And did you feel that your recovery the second time around was easier or the same, or how was it like going through a planned C-section versus an emergency C-section recovery? Was it the same?
No, not at all. Not at all. My recovery for the planned C-section was 100 times easier. I think when you've gone through labor and your body is having contractions, and things are opening and things are moving, and then you have surgery on top of that, you're basically recovering from 2 events, right? Your body is recovering, because I'm sure you did not have a C-section. Were you sore after you had a baby?
Yes, I was.
Yeah, so your body is, my body did that, not all the way, I did not have the issues that you have, but my hips went through it, my uterus went through it.
Well, and I can say, I'm sure you heard in my story, I had horrible back labor with my second.
Yes.
Horrible. My 5,000 million pound husband was putting all of his weight on my back for 15 hours. And so just that alone, the small of my back was sore to touch for upwards of a week, just from that incredible counter pressure that was put there.
Oh my God.
Yeah. So that just that part was something to recover from in and of itself.
Yeah, of course. I mean, of course. Yeah. So when you don't have actual labor, when your body is not going through that, then you just recover from a surgery. And that was a totally different situation, It was very, very different. But what I wasn't expecting, so the whole time I was really confident again. I was like, I know that this surgery is going to be fine. I'm not scared. It's okay. It's, we're going to do it. It's going to be great. And then my husband, the whole time, he was like, oh, surgery, it's scary, the whole thing. And then the day of, as we're driving to the hospital in the car, I just lose it. And I'm like, oh my God, I'm scared.
Oh.
And everything that I had been holding inside and trying to be so brave, I let go, and I was just like, oh, this is scary. And then my husband was like, it's okay, we're gonna meet our daughter today, and it was just this I don't know, it was a very beautiful moment. And throughout my whole pregnancy, my mom had nicknamed my daughter Snowflake. For whatever reason, she just called her Snowflake. And it doesn't snow very often in the Netherlands. But the morning that we arrived to the hospital for the scheduled C-section, and we arrived to our room, I was looking outside the window. A gentle snow started to fall. And I was like, that's a sign, it's snow, and she's a snowflake. And, I just, again, got this, calm feeling, it's going to be fine, everything's okay. And, yeah, and then they started to take me to surgery prep. And what I didn't know, and what I of course didn't have with the emergency C-section, is they came into the room like as they're waiting for the operating room to be free. I'm in the prep room. I'm not sure what you call it, pre-op
Yeah,
room, I
pre-op, I
guess.
think, right.
Pre-op. So they came in, and it was the anesthesiologist along with an intern. And they said, okay, we're here to give you some special injections. And I didn't know, because I didn't have those with the emergency C-section. So it's like an injection with the help of a sonogram machine, with
Okay.
an ultrasound machine. Sorry, not a sonogram machine, an ultrasound machine. So they come in, and the needle has to go in a specific spot, like between a layer of fat and a layer of muscle. And it's like an anesthesia so that you feel less pain for a day or two in that specific location, which in turn, you would need less, painkillers afterwards.
Okay.
That's the idea. But she was learning. The girl that was giving me the shots, she was learning. So it took a very long time for her to do it all. And I mean, the needles are huge. You have to imagine they're going into your stomach, and they have to go into a specific spot. And I was just like, I was really scared. I was shaking. I was shaking and chattering and like really nervous. And I just looked at my husband and I said, "Sing to me." And he just started singing, and like in Spanish. Like, it was very romantic, very sweet. And he just sat there, and I just cried while they did this. And he just wiped away my tears, and he just sang to me. And then the woman, when she finished, she was like, "Where do I get one of those?" Because she's like, "That's really nice." And I was like, "No, he's really nice, but that was really awful what you did. I would have preferred not to have that done." And then my husband always likes to tell the story that once they wheeled me into the room, and we saw Dr. Pelican, and Dr. Pelican's like, "Hey, Jovie, how are you doing? Are you ready to do this?" And I was like, "Dr. Pelican, it doesn't matter if I'm ready. Are you ready? Did you have your coffee this morning? Are you ready to do this operation?" And my husband, we just laugh. He laughs about that a lot. And yeah, so everybody was ready. The team was ready. But again, Dr. Pelican had made it clear that I was going to have to do all the stuff that normally they would do after you get a spinal, that they were going to have to do it before. So I, again, had all those really painful, like the catheter and all that stuff was done, but it was fine because it was fine. I was going to be fine. And then they gave us a really beautiful surprise, which was that they said that my husband could stay there for the surgery.
Okay.
Which he was not allowed to do with Leo when he was born, because of the emergency and et cetera, et cetera. But this time the team had discussed it, and we had gone in thinking Alex cannot be there. He's not allowed in the operating room because I'm going to be under total anesthesia, and that's just a clear rule at the hospital. But what they said is, because everybody was on board, everybody knew in advance, the whole thing was set up, that they wanted to. Alex just had to leave the room while they intubated me.
Okay.
And then they were going to bring him back. So they didn't want him to see that actual, that process. And that was it. And so I was just so happy that he was going to get to be there. And then they said, yeah, and then your husband can do skin to skin with your child if everything's okay until you come out of recovery. So that's actually what happened. The doctors, everything was different this time around because it was all planned and everybody knew. So my husband even got to cut the umbilical cord, and then they told him, take off your shirt, and he took off his shirt, and he was doing skin to skin with her. They finished up my tubal ligation. They finished up my surgery. I guess there was a bit of a scary moment because I lost quite a bit of blood. But they were able to fix that later on by giving me like an iron infusion, and everything was okay. But the first day I didn't really know where I was. Like, I was really foggy just as a result of the blood loss. But my husband was the one, like, he just held her, and he was with her the whole time. She was born with a 10 out of 10 on that scale, which I, again, forgot. APGAR.
Yeah, the APGAR, yeah. So the anesthesia didn't affect her at all?
Right.
Wow.
So she was born with a 10 right away, which, I had a 0 and I had a 10. And those were my two babies total different scores, but it was because she didn't go through all of those horrible, contractions with her heart stopping and all the things that my son had to endure. So yeah, she was great. And so she didn't have to go to the incubator or anything. They let my husband took her to that room where I would later on be recovering in for the next few days. So when I woke up, they gave me a popsicle. And then they said, "You're fine now. Now you can go back to your room." And then they wheeled me to my room. And that's where I saw my husband and met my daughter. And it was amazing. Yeah.
And what a healing experience for your husband, too, after what he
Yeah.
also went through with the first. To be able to see his daughter being born and to have her in his arms, right away, and to cut the cord. I mean, those are special experiences for the other,
Absolutely.
parent.
Absolutely. And it just felt so good to me also to know that he was allowed to be there,
Yeah.
because I know what a horrible experience he had with our son's birth because of that anesthesiologist, and as you were saying, really healing for him. And he's such a devoted dad, and he's really like, he did not miss a single appointment that I went to, and I had a lot of them. He supported, he was there every step of the way. And I think a lot of the time the focus is on mom and baby once the baby is born. But we shouldn't forget the dads, because the dads also play a huge role. I mean, Alex did most of the child care for my pregnancy when I couldn't do it.
Right.
He, if I needed something in the middle of the night, he would get it for me. If I wasn't feeling good, he would do it. He was giving me like a foot rub every night. He was doing all of that stuff, and on top of his work and all of his normal life, So he was really invested in everything. And I don't think that he or other dads that are, supporting their wives or partners in a similar way, they don't necessarily get the credit that they deserve as well.
No, they certainly don't. Which brings another question to mind. What is the paternity leave policy in the Netherlands? Do the fathers get any time off?
Well, it's actually a great question. In this moment, fathers get 1 week off. That is the paternity, which is really kind of crappy.
Yeah.
But as of July 1st, 2020, it will be 6 weeks of leave for dads. So the first week, the first week will have to be paid for by the dad's employer as normal, and the remaining 5 weeks will be paid through the Social Security. But my husband, I had again a different situation because Alex, he works at an international criminal court, so there the dads were always getting 4 weeks of paternity leave. So he had 4 weeks with both of our kids, but then with Luna, our second child, he had so much vacation time saved up in addition to that leave, and he had to take it. It was like a use it or lose it situation. So he said, "Okay, I'm going to use it." So he ended up staying home for 3 months after our daughter was born.
What season was this in, by the way?
She was born in December, so he stayed home December, January, February,
So you
and
got
went back to
all
work
the
on March 1st.
holidays. You had all the holidays together to just hunker down, and oh, that's so nice.
Yeah. So I mean, how many dads take a 3 months? It was like it's crazy, but it was amazing.
Yeah. Oh, and that's got to help with bonding with the kids. I know. So in Sweden, the fathers actually get 8 months of paternity leave, but
wow,
they're
shared
no. So each parent gets 8 months, but it used to be that the men would typically donate a lot of their time to the mother, because you can do that. You can share days if you want. But then the government here not so long ago made it a rule that now at least 4 months of the time the husband or the father needs to take that time. So they actually force the dads to take the time, because all too often the dads were giving the time to the mom so the mom could be home with the babies. And so it's a very, very unique and different situation here. But I think elsewhere in the world, it's not very common at all for the dads to even have time to spend, let alone to take it.
Yeah.
So
and to take it paid. That's the thing. I know that in the States you can also take some time, but it's not necessarily paid. So, and that's really hard when, bringing a new child, it's expensive. expensive. Babies are expensive.
Yep.
So I really appreciate the system in Europe. I mean, in Sweden, it's amazing. In the Netherlands, it's amazing too, that you're able to do that.
Yes, exactly. And especially if you are recovering from a cesarean with a toddler at home
Yeah,
and a newborn. Like
yeah, yeah, totally.
how do women in parts of the world where the dads don't get any time off, how do they manage it? I don't know.
I don't know. And without Kramzorg, because
Yeah.
here we had both for both kids. So yeah, it was, yeah, it's sometimes people think of it like, oh, it's just whatever. But I mean, once you've had like the good system,
Yep.
once you've felt like what it can look like or what it can be, how supportive it can be, I just wish this for every other country. That's why I
Yep.
talk about it on my channel so much. Because I really want to plant the seed and to ask
Exactly.
for other countries to have this for people.
I
Yeah.
believe that it will happen eventually. I just don't know if it's going to be even in our kids' lifetimes, but
Mm,
hopefully the rest of the world catches up, because that time off to just bond with your baby, I
mm.
mean, it's so important. Like, it's just so important for the child's health. So,
Yeah, absolutely.
hopefully. Well, is
Yeah.
there anything else you would like to share about your experience this time, the second time around, I guess I should say?
Well, the second time around, I guess it's because I knew the system better. It's because I knew what to expect and I knew what not to do. So I guess if anybody is listening that is going to have a baby in the Netherlands, and maybe you're like me, where you're thinking, oh, I don't want a midwife, like you're rejecting that thought outright, just don't. Please don't do it, because you're hurting yourself by not going along with how the system is set up. By trying to insist on having the Dutch system adapt to what I was expecting from like the US system, it really caused me a lot of grief. And I think, yeah, that antenatal depression and anxiety was not diagnosed because I was not under the correct care. And it ended up hurting me ultimately. So and not necessarily only in the Netherlands, but whatever country you're in, really try to educate yourself on their birth system or on their approach to birth, and try to adjust your expectations to be in line with that, because it's going to be a lot easier
Yeah, that's
and
great
more
advice.
beneficial.
If anyone wanted to reach out to you and, if they have questions or whatnot, is there a channel that they could reach you at?
Yeah, of course. My YouTube channel is called Jovie's Home, Jovies Home, Home. And it's the same on Instagram and Facebook. So it's Jovie's Home on all my socials. So yeah.
Beautiful. Okay, well, thank you so, so much for taking all this time to share your experience. You had a lot of really good wisdom and tips, and I know it will be useful to people who listen in the future for sure.
Thank you. No, thank you so much. I'm sorry that it was so long and so many different things, but I really appreciate the opportunity to actually talk about birth too, because it's beautiful and wonderful. And I was not into. Were you into birth before you had your own kids?
Not at all, and now, as you can see, it has completely taken over my life. It was the most
Right.
beautiful and empowering experience of my
Yes.
life, and I can't stop talking about it. So
Yes, I feel the same. So that's the thing. Like, I feel the same way. Until I had my own children, like birth, I was like, bleh. And now I'm like, oh, tell me your birth story. I want to know all the details. Like,
exactly.
so it's really fascinating how much you change once you've gone through that experience and that process. I don't know if other women feel that sense of passion about it too, but it really is an empowering thing.
It is, and it's something that I feel like needs to be talked more about, so that people aren't taught to fear birth or think that it needs to be this institutionalized, medicalized event in our life.
Oh yeah, no, definitely. You know what? One other thing that maybe is worth mentioning
Hmm.
here is you hear a lot of women talking about their post-baby bodies and how they feel about that, and the stretch marks and the C-section scars and whatever changes your body goes through. My experience is, and I really hope that other women feel the same way, or if you hear me that this gives you like an idea or something, but my body will never look the same as it did before I had a baby. And I mean, I'm rounder now than I was before. Um, but I have never felt more confident as a woman. my body grew and fed 2 children, 2 human beings. Who can say that? I mean, every woman that's had children can say that, but I mean, like, my body did that. So, like, yeah, a stretch mark? Hell yeah, that stretch mark contributed to my baby growing well in my stomach. The C-section scar? Yeah, that was how my baby was born. You want to say something about my body? I have 2 humans that I made. What did you do?
Yep.
You know, like, that's really how I feel. I became so much more confident after having my children, not because my body looked better, but because I have this whole new appreciation for what my body can do.
Yep.
My body is freaking amazing. Doesn't matter how it looks. It grew, fed, and birthed 2 children. I had C-section births, but it doesn't matter. I grew a baby from an egg and a sperm. It became full size in my tummy. I did that. And okay, it came out a little bit different than maybe some other babies, but
the baby was still born. Exactly.
Yeah, you know?
Yep.
And that's what my body did that.
Yep.
You know? So I just think it's so important not to think about, oh, am I going to fit in my jeans? No, girl, you made a human, okay? Just you made a human. So be proud of that. Like, that's very important.
Well, you know, and people spend so much money getting tattoos to commemorate, you know, big events in their life. And I mean, what better thing than to have sort of nature's tattoo to remind you for the rest of your life of that short period of time. You know, it's nice sometimes to look back and think, wow, yeah, that did actually happen, you know?
Yeah. And sometimes I can sometimes feel my scar. Like, you know, there will be moments when I make a movement and then, like, I can feel some pulling or some tension or whatever. And then I'm immediately transported back to that moment of when I had my baby. I mean, now she'll be 2 in December. So it's been, you know, almost 2 years since my last baby. But I'm immediately transported back to that and those feelings of, you know, little baby smell and those moments of cocooning at home and just being a family and just, like, you know, that was all that was important. So when I see that, when I feel my scar or when it hurts or, you know, when I look at something, I'm just reminded of all the good things and not the bad things.
Oh, that's so beautiful.
Well, thanks so much for tuning in, you guys, and listening to the conclusion of Jovie's stories. I hope you enjoyed these episodes and found them interesting. And like I say at the end of each of my episodes, if you happen to have given birth abroad or sought fertility treatments overseas or went through postpartum in a foreign country or what have you, and you have a story that you would like to share, please feel free to email me at thebirthabroadpodcast@gmail.com because I'd love to talk to you more about it. Thanks so much, and tune in next time for another episode of Someone Birthing Abroad. Bye, guys.